Greetings, everyone. I am John Gray McJuliet from Cameroon, and I will be on the affirmative side for the topic Should African countries adopt genetic passports to tailor public health interventions? Genetic passports are digital portable health records that contain an individual's genetic data. They aid in guiding public health interventions tailored to individuals and populations. Africa faces diverse genetic landscapes, rising non-communicable diseases, and limited resources. And that's why I will be saying that yes, Africa should adopt genetic passports to strengthen precision health. Public health cannot remain a one-size-fits-all in a continent as genetically diverse as Africa. Genetic passports offer a pathway to precision, prevention, and progress, placing Africa at the cutting edge of equitable health innovation. Imagine a genetic passport identifies that a community has a specific gene variant that affects how they metabolize a common drug, you can say malaria. With this knowledge, public health officials could recommend a different, more effective medication or readjust dosages, saving lives and resources. And they will be moving from generalized policies to target and evidence-based actions. Non-communicable diseases like diabetes and hypertension are one of are on the rise in Africa. Often they are diagnosed late when treatment is much more complex and costly. And this is where predictive tools for genetic predisposition come in for early intervention and prevention care, which is going to cut long-term healthcare costs and save public health budget. Limited public health budgets in many African countries often lead to inefficient spending on generalized campaigns that may not be effective for everyone. By using genetic data, countries can direct limited resources to high-risk populations, prevent waste in low-risk groups, and improve health equity through smarter targeting. We often rely on external systems and expertise for healthcare innovation systems, which for healthcare innovation systems, and in order to encourage genomic medicine in Africa, adoption should accelerate integration of genomics into healthcare, build local expertise laboratories and innovation capacity, and reduce this dependency on external systems. Africa risks being left behind in the global precision revolution. A clear Pan-African policy on genetic passports could make the continent an attractive partner for multinational pharmaceutical companies and research institutions looking to develop new genetically targeted treatments. This would give Africa a seat at the table in shaping the future of global health. Friends, colleagues, and members of the opposing team, I know this topic raises important questions, and I expect the opponent to bring up concerns about privacy, ethics, and cost. I've thought deeply about these challenges, and the answers to this will be on privacy and security. I'm not talking about a flimsy system. Adopting genetic passports requires strong legal frameworks and secure decentralized data storage where citizens control their own data. The biggest risk is not about protecting this information, it's failing to use it to save lives. On privacy and security, We're not talking about on ethics and human rights. The proposal is built on a foundation of transparency and consent. No one will be forced to participate. This is not about discrimination. It's about empowerment and about using science to build more equitable healthcare systems. We believe on equity and accessibility. We believe this must be a public good, not a private luxury. Government must subsidize this technology and use existing infrastructure like mobile networks to ensure everyone, including those in rural areas, can benefit. On readiness and cost, I understand this is a major undertaking. That's why we propose a stepwise adoption, starting with focused pilot projects. The long-term cost of continuing with an inefficient, reactive healthcare system are far higher than the investment needed for prevention. In Africa, especially in Cameroon, there's this saying that goes with this: prevention is better than cure. In short, the opposition's concerns are not a roadblock, they are a call to action, and considering them, we have a path forward that is secure, ethical, and equitable. Genetic passports are not a luxury, they are a necessity for Africa's future. By tailoring public health interventions, preventing diseases early, and using resources wisely, African nations can lead the way in ethical, equitable, and innovative healthcare. The question is not whether we can afford to adopt them, but whether we can afford not to. Thank you. These are some references for more reading.